All right, the time is 3 minutes past 5. It's Monday, January 24th. It's a special meeting of the local Southampton School Committee. 4 of the 5 members present. Julianne will not be able to attend tonight. We also have Stephanie Foss, Elisa Pluta, and Dr. Bonneville in attendance tonight with members of the public. Sole item on the agenda today is to discuss the governor's update from last week regarding updating testing and material being provided. I will just note for the record that the committee as a whole should have received a chain of communications that we'll just incorporate as part of the record between the chair of the Board of Health and Stephanie, going back and forth with their thoughts on that. And I believe I'm working off an iPad tonight, so I can't really see everybody, but I believe Caitlin is here possibly if we—
I'm here.
There you go. If we have any questions directed towards her. But I think if you read that communication, we can kind of get right to it. Any questions before we start? No? Okay. Stephanie, you've got the first 3 minutes as Allison needs to make dinner for her family.
All right, fair enough. So DESE and DPH have come together to offer another type of surveillance screening for schools. And in order for schools to opt into this, we also have to discontinue the test and stay program and contact tracing for in-school close contacts. And in order to do that, we have to agree to continue pooled testing. So this isn't in place of pooled testing. This would be an additional surveillance screening with pool testing. And so we would continue our pool testing only for those families that consent to pool testing or staff that consent to pool testing on Tuesdays. And then this additional program is an opt-in. And so it's slightly different than consenting. We wouldn't be sharing any information with a third party, so people don't have to provide consent. They opt in. And so what that looks like is just sharing their name and basically what school they're at, so we know, who to deliver their test to. And it would be a test that is administered at home on a day of their choosing. But I think, we would want to encourage our families and our staff to do it possibly later in the week, where we're already offering pool testing on Tuesdays. It would make sense for them to utilize this home test on Thursdays or Fridays. And so, this does not change. We still would not want people that are symptomatic coming to school. Those protocols would stay the same. This would really just change the practice of when you have somebody that is in school while symptomatic, we would not contact trace. We would not identify the close contacts within the school building that were exposed at school, and they would not have to test and stay. They would not have to quarantine. And, DESE compiled a lot of data, both from across the nation and across the state. The state data, individuals that conducted test and stay, 98.6 of them remained negative. So, they're just really stressing that transmission is not happening in schools. That's not the primary place that transmission is occurring. It's within households, and it's in these, other community exposures. And so when you think about all the resources and the time that is spent on contact tracing, for just one positive case, our school nurses could spend anywhere from 1.5 to 2 hours identifying all the close contacts that need to quarantine, calling those families and explaining quarantine or explaining the test and stay option to them if they're eligible, as well as then notifying all the exempt close contacts who don't really need to do anything, but just to notify them that they're exposed. This would really allow them to refocus their efforts on case management of truly positive individuals, symptomatic individuals, and taking care of the kids that are right in front of them. I think they're being pulled to contact tracing and COVID case management so much that they are taking care of our kids in the school building, and they're doing a phenomenal job of balancing all of those things. But they're not giving the time that they want to give to their students in front of them because they're being pulled to trace these cases that don't, amount to transmission. I did look at numbers across our district. We've had 275 kids participate in Test and Stay, and 6 of them tested positive. So it was about 2.18%. So we're talking a really, low likelihood of transmission. And as more and more kids get vaccinated, there are also more and more kids that are not eligible to participate in this program. If somebody's fully vaccinated, they're exempt and they would not be able to access this program. So, I'm personally in favor of this. I think it would be the right move, and it feels like a reasonably safe thing to do, knowing that this is not where school is not where spread is happening. And just to clarify, anyone exposed outside of school, anyone exposed within their household, if they are not fully vaccinated, they would still have to follow those quarantine protocols and test on day 5 to return on day 6. If this is something that, we decided to move forward with, they could start sending kits to staff as early as next week and to students, I believe, the following week. And they sort of explained that it would be staggered at first. Staff would get kits one week and students the next, with the eventual plan to merge distribution to staff and students on the same week. Each time they receive a test kit, it'll have 2 tests within the kit. So a kit is supposed to last them for 2 weeks. We would not have to track negative results. If somebody's negative, great. If somebody is positive, is the only time they would need to communicate that information to the school nurses, so we can offer guidance on isolation and when they could return at that point.
Stephanie, when you gave the district number, I think like 2.8 maybe, was that the district of Norris or all 5?
Sorry, that was all 5 schools participating.
Right. So if we whittle it down to Norris, it's even a smaller percentage.
Yeah. Only one of the students was a Norris student.
Okay. And I know you just said that, you're in favor of this approach and going in that direction. And I'm assuming if we approve it tonight, there would be some sort of, not necessarily overkill, but some sort of communication out to the parents. And this is a way for us to transition away from, at least how I see it, away from the school taking responsibility and giving the tools back to the parents and letting the parents make their own decisions as they do, right? Because the kid, I guess as I envisioned, the kids would come to the school would then pass the kits out to the students, and the students would bring them home. And then the parents or guardians would oversee the process, and we would provide guidance of pool testing happens on Tuesday, so we'd like you to do this testing on Thursday/Friday, right? And then, how to do it. We're almost getting to the stage of, my child now has the flu symptoms, so I'm going to keep them home for X amount of days over this, back to normalcy, so to speak. Is this the path we're on?
Yeah.
Okay.
Absolutely.
Any other committee members, questions?
I know that my school they didn't vote on it. They just said, we're doing it. And the opting in was a super easy, you click on a link and it was basically write your name and that was it. So it was a super fast, easy process to start also. And I think it's already going out to teachers this week. So they are coming on the quick side.
Oh, sorry, Elson. We did collect staff names last week, and it literally took 5 seconds, and we already have 240 out of 360 signed up. So I think it's wonderful. And if you can't use it, perhaps a family member could use it, and it just is to keep everybody safe. I do like that it's for vax and unvaxxed students, because the test and stay is only for the unvaxxed. So as Stephanie said, as those numbers increase of those that are vaccinated, this reaches a broader audience. So we are really looking for you to have a vote to revoke test and stay in favor of at-home testing kits.
Okay, Dylan?
Thanks. I just had a couple of questions. How does this affect symptomatic testing? Is there still an expectation of a negative PCR test if you have any of the symptoms, or can this be used as a get back into school?
Yes, if they have symptoms, they could absolutely use this test as proof of a negative. We have, since DESE put out the updated guidance with DPH at the end of December, we have adjusted our protocols to allow rapid antigen tests, and that includes home tests.
Okay.
Yeah, so we could absolutely, families could use this if a child is experiencing symptoms as their proof of a negative for symptoms.
To the Deanna answered my vaccinated question. And I think the other question I had is, how does this going to affect with families? I know we've had a bunch of cases in school in the last few weeks. If a student has had a recent case of COVID, is there a period of time they have to wait before using these tests? Do you know?
So DESE did not give us a specific timeline, but because it is an antigen test, they would be able to opt in. Antigen tests are not as sensitive as a PCR test. So, when you hear about someone who's been positive and could test positive for 90 days still, that would be on a PCR test. So anyone who test positive, we will continue to hold them out of pooled testing for that 90-day period, but they could opt into this program once they're out of their isolation. I would sort of advise families, I think, to wait even a little bit beyond their isolation period. They've seen people testing positive up to 14 days from their initial positive on an antigen test. But after that, it would be okay for them to opt in.
So Stephanie, can you clarify this? So if a student is out 5 days, they're vaccinated or unvaccinated, doesn't matter. The isolation period is 5 days. On day 6, they don't have any symptoms, but they take the rapid test and test positive. Are they supposed to stay home until they get a negative result on that test, or?
No. So as of right now, the guidance is just they can return on day 6 as long as there is an improvement in symptoms and they have no fever for 24 hours before returning without the use of, fever reducing meds. There is no guidance for schools to require a negative antigen test to come out of isolation.
Is that different for each district? Because that's not how my district is doing it.
Yes, districts can certainly choose to be more strict. Per DESE's guidance, we do not have to require a test. I know Springfield Public Schools is requiring anyone coming out of isolation before day 10 to provide a negative antigen test. And then, after day 11, they're able to come back with or without a test. At this point, we have just been doing improvement in symptoms and fever-free. Yeah.
Any other questions?
Sorry, John, go ahead.
No, go ahead, Austin, if you have questions.
I was curious about, it might be a little bit of an aside, but if we have similar numbers about pooled testing. I know that we have to offer pooled testing because it's a requirement to offer this one, but do we have that data somewhere?
In terms of how many have been positive?
I'm curious about the efficacy of pool testing in our school?
So, I don't have that information readily available. I could definitely get it together, though, for your next school committee meeting for you to have. We have definitely identified, I want to say, at least 10 positives. We did have an incident, though, like if you follow the data put out by DESE, they do report back our number of positive pools, and that's not given to them from us. That's collected from the testing software where all that information is managed. And we had a changeover in testing teams one week in which they tested individuals that were still within their 90-day window. And so our numbers in the DESE data is a little bit more elevated than what it truly has been, because those individuals that were not actually, positive and contagious, they were just still testing positive from a previous infection, are captured there.
Thank you.
So question, so I'm assuming that all administration's in support of Stephanie's position. And do we have any feedback from the association one way or the other, or no? Just to make it part of the record if there is.
I didn't reach out specifically to Elizabeth, but considering 3/4 of faculty have already signed up for it, I don't know, I could look up the percentage at Norris right now, but I think they're in favor of it for sure.
Okay. Any other discussion? If not, the motion for somebody to consider making is to, I guess, is it immediately or a week from today, or when the testing kits become
I'll do it
available?
as soon as consent is accepted, because they have to consent on that website or the link or whatever it is.
According to the formal document from DESE, it is after January 31st, districts that opt into this can discontinue the test and stay and the contact tracing for in-school exposures.
Okay. So is there a motion to that effect?
I'll make a motion.
Is there a second?
So,
I'll second.
Second by discussion. Dylan? No? Okay. No discussion? All in favor?
Aye.
Oh, I'm sorry.
you have to roll call.
Yep.
It's roll. Yeah.
But don't start with Allison, because she doesn't like to go first.
actually-
Right on, aye.
Austin,
Rogers, aye.
Dylan,
Maudsley, aye.
and Lumber, aye. So it's 4-0. Anything else?
No,
Okay.
just FYI, 58 teachers at Norris have signed up, teachers and staff.
It's a good start. And like I said, I can't emphasize enough, the more we do with communication on this to the parents and guardians, to get it out. The 31st will be here before we know it. So, all right, if that's it, the time, it's 5:22. I'll entertain a motion to adjourn the meeting.
Motion to adjourn.
All right,
Second.
seconded by Austin. All in favor? Aye.
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 All right.
Thank you.
Thank you, everybody.
Thank you
Enjoy
very
your
much.
evening.
Take care.